Hey legends, I'm Eliza Lee and you're listening to The Making of an Incredible MD, the podcast for aspiring medical professionals. Each week, we'll bring in a current MD student and a practicing physician to talk about an important topic in the medical field. From the effects of climate change to the influence of social media on our health, we'll uncover a maze of different perspectives and end each episode with an ethical dilemma for us all to consider. Stay tuned as we literally hear the making of these incredible MDs unfold right before our ears. Sam was once medical doctor by day and full-stack coder by night, and is now co-founder of Ally Assist, a social enterprise that is on a mission to achieve health equality in Australia by providing in-home and community healthcare services. Now that we've heard Manoj's perspective on doctors going digital, I thought it'd be nice to contrast it with Sam's experience, having built the Ally Assist technology and been in clinical practice as well. You went like one, so I was expecting a two.
Yeah, you expected what? You expected wrong.
So after a bit of a false start, we got to cover some ground. So here's the recording. I love that Sam is on this episode because he's not just a medical doctor, but also a full stack coder, which is amazing. I think we'll have incredible insight into sort of the back of all this. So I would just love you to introduce yourself, Sam, about how you sort of got into the whole tech side of things.
Sure. So my name's Sam. I'm a medical doctor, and I am the CEO of a small healthcare startup called Ally Assist. And I build our web application there. For me, actually, I feel like coding is one of the easiest things to get into because the feedback loops are really tight. You make an error, you can see you've made it instantly, and then you can Google that error to find out how to fix it. So I started, and it took me about 6 months to learn, I guess, from having almost no coding knowledge to then being able to build like a kind of a fully functioning web app. Had some issues, but in the 2 years after that, certainly been able to fix a lot of those issues and build something that works pretty well and is pretty safe and can service a lot of people.
Yeah, well, actually being the person who has built the web app behind and the technology behind Ally Assist, one of the big goals, obviously, of Ally Assist is to be able to solve some of those really big health inequalities that exist in Australia. What are some of the big disparities, I guess, Ally Assist is sort of solving right now with your services?
Oh, sure. Like the big disparities. So the biggest one we're addressing, I can talk about people with a disability. The way the current system is, I can compare this to how it works in a hospital. So in a hospital, let's say you go in to hospital and you're kind of like on the mend, your main medical problem has been fixed up, and now you're just getting seen by the allied health team in preparation for going home. Maybe you've been in hospital for a while and you're deconditioned. And let's say you're seeing a physiotherapist. In the hospital, the physiotherapist will come and see you. They'll do an assessment, kind of figure out, what exercises you need to do. They'll often get you to, if you've had like a big surgery, they need to improve your lung capacity because a lot of the time if you're laying still and not breathing for a long time, you've been tubed, your lungs can kind of collapse. So they get you to do like an exercise where you blow, into a straw, blow into a cup of water for as long as you can. It kind of like helps to expand your lungs again after a big surgery. It's a pretty common one. So let's just say that's happened and you're also, walking up and down the wards, just trying to get some of your walking strength back before you go home. The physiotherapist will see you, kind of prescribe a bunch of exercises for you to do. And then you'll be seen by what's called like a physiotherapy assistant, which is usually like a physiotherapy student, like studying at university. And then they kind of like just implement all the exercises and the plans that the physiotherapist has prescribed to you. That exists all in the hospital, but unfortunately it doesn't exist in the community. So they only sort of see that physiotherapist, and then in between sessions, they have homework to do, but they don't really do that much for a bunch of different reasons. But what Ally Assist does is it uses technology to link people in the community that live nearby a physiotherapy assistant, and then the assistant can go to their house and they can implement the exercises that the clients or the patient's physiotherapist has recommended. And I guess the disparities that addresses is that I guess number one is that the health inequality for people with disability, if you're out in the community, you don't sort of have the services that you need to truly, I guess, reach your therapy goals in the most efficient way possible. People are still reaching their goals, but it could be certainly optimized. And then on top of that, we have another barrier, which is people that might not have like a super high health awareness. I'll talk in particular about families, that might not have a high health literacy, and also families that just don't have a lot of time, which is a lot of them. So if you've got a family with one child with disability, the chance of having another child with disability is actually heightened. So a lot of our users are parents with multiple kids that have a disability, and they will see their physio, they'll get some exercises prescribed, or they'll see their speech therapist or occupational therapist, but they just won't have enough time or resources to kind of like do all the things that need to be done. And they also might not have the health literacy to kind of understand the importance of these things. So that's what LSS aims to address. We can actually just send somebody in there that has enough knowledge and time, and they're also affordable to kind of like help with all those things.
Well, thank you so much for the people that you serve. It really does make a difference. As our health system and doctors go more digital, especially with sort of the adoption of telehealth being so pushed forward from the pandemic and how everyone's rushing to digitalize a lot of the health services, what are some of those shortfalls and cautions that we need to be a bit more considerate about when designing digitalized health systems?
The big first one that comes to mind is safety. I certainly can understand that there's like, it's something from the statistics, it's something a lot of companies are only sort of, turning more to now. In the past, I'm going to try to remember the statistics properly, but don't quote me on this. But I think it was in the last 20 years, most companies would do what's called like a penetration test. So they would check their security only to meet compliance standards. So they would only fix their security basically to tick a box. But I guess a lot of companies now are realizing the huge implications that having a data breach can have. And they're starting to, get penetration tested and do bug bounties in order to improve their security so that they can prevent these security attacks. Like, they're getting more serious about it. People actually want to prevent security breaches rather than just, getting the security tested just to tick a box that the government will be happy. So the big thing I can think about if we're moving everything digital is breaches of our personal health data, which a lot of people don't think about, but it's quite a big deal if somebody can have your data. There's a lot somebody can do with that, especially if you're a child. A lot of my GP friends are doing telehealth, and I haven't heard any kind of like anything bad about it. There's a lot of situations where I wonder how telehealth would deal with these things. In particular, like, I guess a common story for GPs is patients that exhibit drug-seeking behavior and maybe some doctor shopping. There's a couple of online tools that have been put in place over the last year to kind of prevent that, something called SafeScript. But I imagine maybe dealing with those kind of patients or patients that are emotionally labile might be a little bit more difficult over telehealth. But yeah.
And also just like, what do you think in the coming future are the functions of a doctor that can be digitalized, and what are sort of the limits of what can't be?
Well, I don't know. Have you ever had a telehealth appointment? I had one, and it's honestly great. I mean, you can have it from your own house. They set up the technology so you don't have to sort of wait in a waiting room. You get like a rough kind of appointment time, and then the doctor you get like a text message when the doctor's ready to see you. Everything, like the face of, like, I guess being able to chat about your problems, like I still felt cared about, by my doctor. Like I could still feel like they cared about my issue, and like they could empathize with me even though I was looking at them through a screen. And then they can just, like, whatever medications or tests they want to prescribe just gets emailed to the pathology or the chemist, like, around your house. So I actually felt it was like super well done. I was really surprised. I thought the whole rollout would be terrible, but I feel like they really aced it. Yeah, I feel like that's definitely the direction we're heading, and it was such a great experience.
Yeah, that's awesome. And I guess at the end of every episode, we have a bit of an ethical dilemma, and this one's a bit more targeted towards being a medical professional. So should what you say or share online, such as like on social media now, impact your professional career as a medical professional, even if it's totally off a medical forum?
Wow, that's a huge question, I think, because there's a lot of people with alternate views. I mean, like, if you're going to see a doctor, you should probably see them. It's like, do people really, if you're I'm trying to draw a parallel here, but if people need their pipes fixed, does it really matter what views your plumber has? If they're coming over to your house to fix your pipes? Probably not. They could have any kind of views that you might not agree with, but in the end, it might not, or it probably should not affect your decision. But at the same time, being a doctor is like you have, I guess, it's kind of more of an intimate job where you're responsible for somebody else's body. And that can, if you have, I guess, particular views, that could kind of sway your treatment of some individuals. So yeah, in short, that's a huge gray area. I don't know.
So we left it at that it's a bit of a grey area, and you can go and form your own opinion on that one. I hope you enjoyed some perspectives on doctors going digital now that Sam and Manoj have been on, and look forward to a brand new topic about the meaning of life and how doctors view death on the next few episodes. See you then!